Hi, my name is Dr. Fred Sylvester from Hanover Chiropractic, and welcome to this edition of Health Talk. Today we have two optometrists that are in our local area that are going to bring some ideas and some expert opinion on a condition called dry eye. I want to welcome Dr. Brad Riley and Dr. Jen Zerfus as well. They are with Complete Family Eye Care. Complete Family Eye Care has been in our community for the last 10 years. Both have been practicing between 2 to 5 years at this point, so they bring a lot of clinical competency and some great awareness to certain conditions that many people think that they may have to live with at this point. So, Dr. Riley, we're going to talk about basically dry eye and how it affects people. So, again, what is dry eye?
Well, dry eye in itself, it's kind of hard to explain because there's many different causes of it. So, the main reason that people have dry eye is due to inflammation in their eye.
Okay.
And they can kind of experience it in different ways. So, a lot of times we...
So some of the signs and symptoms that would be associated with dry eye would be what?
Signs and symptoms? Sure. Mostly, a lot of times people can get the sense of dryness in their eye, but other things that they can experience are, sandy, gritty feeling, especially they'll feel this towards the end of the day, burning, sometimes like a mucousy discharge. This is usually a little more rare, but can happen in certain cases. So a lot of times computer fatigue, people think that, their prescription isn't correct.
Sure.
So what they'll do is come in saying that, you're not seeing that well, but it turns out to be a little bit because of dryness.
Dry eye. So when I was doing a little bit of the preparation to get ready for this, episode at this point, I thought dry eye was pretty interesting because there are some certain risk factors that might be associated with it. So can you expand on some of the risk factors that people may or may not be aware of?
Sure. I mean, age is one of them. Usually people over 50.
Age, it
I know,
kills
right?
everybody.
Women a little bit more common than men. A lot of times it's because also, we're seeing it actually a lot more in the younger generation too, just because with handheld devices, smartphones, things like that, people are on those a little bit longer. But there's also other things that can kind of go into it. So certain disease processes, like
such as
diabetes, sometimes Sjogren's syndrome, certain autoimmune issues can cause really, really bad dry eye.
Sure.
So we have a lot of patients like that. Allergies, excessive contact lens use, excessive computer.
So define that. What is excessive contact lens? Because that becomes, a point that some people wear them, consistently, sleep with them and that type of stuff. And how can that affect?
Sure. Well, certain contact lenses are designed for sleeping in, but we still don't necessarily recommend it because we want the eye to breathe. I mean, oxygen is very important to the eye to prevent infections and things like that. But everyone's eye is a little bit different. So some people can, wake up first thing in the morning, put their contact lens in, and then take it out right before they go to bed, and they have no issues.
Right.
But no two people are exactly the same. We still don't like having people wear the contact lenses that long. We like, maybe when you come home from work, come home from school, take them out, wear your glasses.
Gotcha.
But what happens is, oxygen just doesn't get to the eye as well when the contact lens is on there, leading to some corneal disruption and some issues that.
What about medications? Any type of medications that we would need to be aware of that might cause a dry eye type of syndrome?
Sure. I mean, there are various medications, allergy medications, sometimes hypertensive medications. A lot of people are on like hydrochlorothiazide, something like that, which is water pills, what they call it. So you get dehydrated from that, and you can get various symptoms from that.
Sure. The last thing I wanted to kind of look at from a hormonal, or from an issue was hormonal standpoint. So as women approach menopause and that type of stuff, do we have a correlation between hormonal change in menopause and dry eye?
Absolutely. I mean, it's not just menopause, but also pregnancy and things like that. So whenever your hormones just aren't acting as they typically should, either from those two instances, we have a lot of dry eye results from them, but it's not necessarily one thing that we can kind of pinpoint on. But
for sure.
It's either we're not producing enough aqueous in our eyes, or your tears are evaporating really quickly off your eyes, and we notice that during those times.
So this leads us into the next two questions. First, what is the prevalence that you see from a dry eye component? Worldwide, nationwide, and locally. What do you notice?
Sure. I mean, as I said before, we're experiencing a lot more dry eye these days than we did before, just because of the instances of smartphones and things like that, where we're always staring. We're at a computer. We're always staring at. But I think there's some studies that have shown that 30 million people in the United
crazy.
States, I know, have been diagnosed with dry eye, and 300 million worldwide, which is, you know,
Yeah, I
pretty,
mean, they're
pretty
staggering
staggering numbers, right?
Absolutely. So let's break down the physiology of the tear. I think it's a very important component. Again, as I'm preparing for this, you learn a lot about different topics that you're coming. So what are the 3 layers of the tears? Why are they important, and what happens?
Sure, and these are all really important to determine kind of what the best treatment option is. So the inner layer of the tear is called the mucin layer. It helps your tears actually stick to your eyes. The next layer is called the aqueous layer. We call it the water layer. It provides nutrients, things like that. And they're produced by your lacrimal glands. And certain diseases can cause, certain autoimmune diseases can actually attack that lacrimal gland, helping you or making you not produce the amount of correct tears. The last layer is the lipid layer, which are produced by your eyelids, and they secrete oil to coat your tears to prevent them from evaporating. And, you know, mostly we see dry eye resulting or causing problems with those last two layers. And we treat them differently depending on what we see.
So in our conversation, as we've been looking at the signs and symptoms, and we've been looking at the traditional person that might be affected here, what would a person expect to have the expectations if they came to your office? If they have dry eye, what would there be expectations? What would their experience be like?
Sure. And this type of workup is specifically tailored for the patient, okay?
Sure.
Because there are a couple different types of dry eyes. There's evaporative dry eye, as well as dry eye that is caused by decreased tear film production. So really what we're looking to do is determine exactly what the cause is. So we're looking at a couple of different factors. We're looking at the structure of their eye, how they're blinking, their eyelid formation.
Sure.
We're looking at their specific symptoms, their history, what medications they might be on, what their other diagnosis, other systemic, history might be, and how that plays a role in dry eye. And then we're also going deeper into what causes dry eye and what causes their dry eye. So we can actually take samples of the tear film and actually measure something called the osmolarity, which tells us specifically about the tear content. We actually can do a test that determines if there's inflammation involved. Okay, there's a specific inflammatory factor that is present in dry eye that we can determine if a patient has that, and that determines if they have one of the chronicity of dry eye, and that dictates our treatment plan as well. Okay.
So when we're looking at, so when you do the workup and that type of stuff, what is your typical treatment plan going to look like for a patient? Because it sounds like dry eye is different than inflammation, and you may be treating 2 different components of that. And how does that all work, and how do you formulate that treatment plan?
So again, depending upon the patient, we're deciding if we need to, one, add tears or have them use some artificial teardrops, for example. If we have to have them conserve tears, which means that we need to essentially put a plug in their tear duct to keep the tears on the eye longer. There's also other therapies like heat therapies to help the glands produce oils a little bit more comfortably, more adequately, so patients have more adequate tears, keeping those tears on their eyes a little bit longer. But there's also other treatments. There's oral medications that we can prescribe to help with inflammation, as well as topical medications, things like Restasis or Xiidra, which people might have heard about, which help to stop that inflammation and get them to a more comfortable state where we're hopefully stopping the chronic nature of the dry eye condition.
Is there a cure for it, or is it just managed?
Unfortunately, there is no exact cure for it. Most of it is management and keeping that inflammation at bay, so we're not getting those chronic issues. And the chronic issues we're more concerned about are issues that can affect the eyelids and the cornea, which are responsible for adequate eyesight. So essentially, we're helping to preserve vision.
And that was my next question. If somebody does not pursue some type of treatment or we'll say intervention with you, what are the risks that may develop if they don't pursue anything?
And that's a great question. So at the end of the day, with dry eye, it can cause severe damage to the cornea. Someone who's not treating it appropriately can essentially have small abrasions or even larger abrasions on their eye, and that can lead to decreased vision, surely discomfort, and potentially decreased quality of life if their vision is severely impacted.
So as you start to move your treatments and you start to move through it, I was kind of curious about this because I came through some of the research as I read through some of the research about smoking. Does smoking have any effect on dry eye? So if a person who smokes and that type of stuff, does that have a factor into this?
Yeah, I mean, like smoking can affect obviously a lot in the body, but
Sure.
yeah, it certainly can impact dry eyes as well, or your eyes.
So
Okay?
there can be some environmental factors that affect this as well, not just allergies, but smoking.
Absolutely. So smoking, even if you're not smoking yourself, but being in a household or around somebody who's smoking can certainly be a detriment to your eyes.
So one of the things that we were talking about in the first part of the segment was we were talking about the increased computer use, or we'll say handheld device time at this point. And what is the connection between looking at this computer screen and dry eye? Doesn't make sense.
Yeah, so that's a great question, especially with how prevalent,
Yeah.
we all use devices.
I think my teenagers, I think how much they're on it, I'm thinking, geez.
So basically what happens in order for us to have a great tear film, we need to have good lipid production, okay? And where the lipids are produced, so produced by glands around our eyelids, okay? In order for those lipids to essentially come out of those glands, we have to blink, okay? So it's the action of the blink, the upper eyelid pressing down on the lower eyelid for those glands to express. And what happens is when we're using devices, we are not blinking as much.
Sure.
So frequency or as fully as we should, okay? So think about your kid sitting on his device. He's staring at that screen all day long and, not blinking probably as much and, partial blink so he's not missing out on the action. So oftentimes those people can develop glands that become what we call stagnant, which means that they become blocked or not producing that lipid enough. And that can be a big part in dry eye.
So if you don't use it, you lose it? Basically is what it comes down to?
Yeah, essentially, because those glands that perform that function they can actually
Atrophy.
atrophy. Yeah, they can.
So is there an exercise that you can do if somebody is on the computer or on the handheld device for a long period of time? What would you recommend that they do?
So obviously one thing we would recommend is moderation, but obviously that's hard to tell a lot of people. So one thing that you can do is be mindful of your blinks, okay? So take a good, nice hard blink, do that 5 times, and then kind of relax, okay?
I love that. So again, with everything that we've kind of went over, from the signs and symptoms to the workup to the treatment, what's your take-home message?
Sure. Dry eye is something that is a chronic condition. It affects a large amount of the population.
Sure does.
And it, even though it might not be curable, it is very treatable and manageable. And it is something that, people should come in for a workup if they feel like they have any symptoms. Or even if they don't have symptoms,
Right.
It is something that needs to be managed. So it's making you more comfortable and preserving your vision in the long run.
Absolutely. Doctors, I want to thank you very much for being on our show. You guys provided a plethora of information. And again, I think what I think is amazing about the information you give is that a lot of people would maybe blow this stuff off, and when they don't have to. And they could improve their quality of life. So I think it's an amazing service. And I think you guys are the only ones in the area that have a center that is dedicated to the dry eye, if I'm not mistaken.
I believe so, yes.
And I mean, so that just places you in another level of expertise and care that's being delivered in our community. So I want to thank you for your time, for being here.
Thank you.
I want to say good day and good health.